specialist in Oklahoma City off of Northwest Expressway, alongside Megan Van Camp and Megan Kane. They're two incredible dietitians that really wanted to be here today, but weren't able to. So I'm going to talk about nutrition for autism. What we'll talk about today will be why nutrition is important in the first place, what unique challenges that children on the spectrum will face, and then what happens whenever you are able to connect with a dietitian. We help you kind of break down what might be a complicated situation into more simpler steps. So those involve shifting into a healthy diet, developing more structure within your eating plan, addressing any gastrointestinal issues that the child may be having, and I'll also discuss some common nutrition therapies that are used for treating autism. So why is nutrition important in the first place? According to a USDA report, about 3/4 of Americans, 3/4, which is a pretty significant number, eat a diet that's low in fruits, low in vegetables, low in dairy as well as oils. And then we also tend to consume excess sugar and sodium and saturated fat, which is the not so heart healthy fat. So this is the American population as a whole. Now think about this group of children with autism that pose an even greater challenge because of some selective eating, some difficulty feeding, as well as some underlying gastrointestinal issues. So further, we can see possible deficiencies in nutrients developing because of this limited diet. So this can have an effect on the brain, other physical developments such as bone mass, for example. So if we know that nutrition can affect the brain, we can expect to see some improvements possibly in behaviors and responses to therapy once nutrition is replenished and restored. Another reason nutrition is important, especially for autism, staying well. Nutrition supports the immune system. So if you're one of those families that illness gets passed from family member to family member to family member, it keeps the whole family healthier as a whole. If the child can stay healthier, this is going to affect potential absence from school, doctor's appointments, therapies. Nutrition also helps bowel habits. If we could simply increase fiber in the diet, increase water, it may just take that, although I understand that's not always a simple process. And then also discovering which foods might be problematic and removing those from the diet, that might also help bowel function as well. And then nutrition is also going to affect meal times. If we can figure out ways of making meals more pleasant, where there are less tantrums, less food refusals, less stomach discomfort, being able to sit through start and finish of a meal, that's going to make it a lot more pleasant for everybody. So as you can see, proper nutrition affects every aspect of a child's life, their physical and their emotional well-being. Common challenges that children are going to face on the spectrum. Of course, we're going to see a lot of times limited food selection and intake. This can pose a real problem between the parent or caregiver and the child. Meal times will tend to turn into a battleground of wills. And so children with autism, they've been shown to have stronger food preferences compared to other children. This is for many reasons. There's going to be heightened sensitivity to food textures, colors, flavors, whether they're touching each other, but also preferences for the types of utensils and plates that are used at meal times, or where we're sitting, or what the rest of the environment looks like. And also we're going to see that this population does tend to eat less vegetables, less fruits, as well as less dairy, even when casein is not restricted from the diet. This is especially of concern because there have been studies that reveal that children with autism might have shown to have less bone mass compared to other children as well. Nutrient deficiencies that I had mentioned earlier, this is due to either a limited variety of foods in the diet or impaired absorption of nutrients, or both. And then gastrointestinal disturbances are another challenge. It can be affected by what the child eats, and it can also affect what the child eats. Feeding difficulties also pose a challenge. This could be an inability to move past pureed textures. It could be a muscle tone issue during the eating. It could be an impaired ability to feed the self. It could be positioning of the teeth and tongue, positioning in the chair, and also difficulty swallowing, which we see a lot of kiddos having some trouble with. And then if a child is requiring a feeding tube for nutrition, we need to see, well, how educated is the parent or caregiver on the tube feeding regimen? Are they following up with someone that can help them to continue to provide nutrition for the growing needs of the child? And then what's the outlook for this child transitioning into an oral diet in the future? Another nutrition challenge we're going to see, well, how is the child able to communicate to you that there is a problem during the feeding experience, especially if they're nonverbal? So what kind of behaviors are they going to display? Sometimes these can be taken as non-food related behaviors that we aren't exactly connecting. And then medication interactions can also pose a challenge, because some medications can affect appetite, they can affect nutrient absorption. So it's a good idea to ask your healthcare provider about any potential side effects. Feeding difficulties. So picky eating, it's a normal phase in childhood development. We're going to expect to see about 50% of all children with selective eating. We typically see this around age 3 to 5. So we can also expect, though, to see children on the spectrum to be more inclined to be picky. There's going to be a limited variety in the diet. That's part of normal development, but also inappropriate reinforcement from caregivers. If, there's a child that's refusing food and the parent reacts negatively or scares them or threatens them, it makes them a little bit more leery to try the food in the future. So you need to understand that cravings for certain foods can affect the variety in the diet, or issues relating to digestion again. So comparing feeding difficulties, we can see a picky eater, they have about 30 foods in their diet that they're going to eat. At least one food of a varied type and texture. They're going to tolerate foods after 10 or more exposures, and then they're going to burn out on their favorite food temporarily, but they're going to come back to it later on. But what we call a problem feeder, there's even less variety in the diet. There's about fewer than 20 foods. Complete food refusal, we're going to see gagging, vomiting, and choking at this stage. Food jags, if you're not sure what a food jag is, it's selecting a food and only eating it, possibly for every meal. And it can be a way of the child asserting independence over the situation. We can also see extreme picky eating, where there's a severe food aversion, possibly at every meal. There's usually some medical impairments that drive this, and this is whenever we see less than 15 foods. And again, we're going to experience some food jags as well. The issue we have with problem feeders and then the more extreme eaters, we're going to see poor growth status. Again, there could be a medical issue that's driving that behavior. We're going to see this for several reasons. Hyposensitivity, that's where a child might prefer more spices and more flavor to their meals. They just need more. And so we're going to see a little bit messier eating. We're going to see some food stuffing and pocketing, some drooling past the stage of teething. And but we're also going to see at the other end hypersensitivity. So you might prefer blander foods. Spices are just too much. And slimy foods, which we often see fruits and vegetables in that category. And so this is too overwhelming for the sensory experience. Sensory integration and dysfunction. So we take this for granted, our five senses, but whenever you have the sensory integration and dysfunction, if you can imagine how overwhelming it would be to hear a food cooking or hear how it sounds whenever you're chewing on it, and to feel the way it feels in your hands or in your mouth, or how it feels on the spoon, whether or not it's touching another food, what color it is. We don't think about these things, but for a child on the spectrum that does have this issue, it's overwhelming. And even one of those senses can ruin a meal. We also need to consider, has there ever been a traumatic experience, maybe a medical procedure, a dental procedure, that has traumatized the child to the point where they're a bit orally defensive, so they don't like things close to their mouth, or they don't like to be fed. And as previously mentioned, there could be instances where there's some improper reinforcement by the caregiver in combination with an unpleasant reaction from eating the food. Maybe they had trouble swallowing, there was a GI disturbance, and that is further exacerbating this feeding problem. So how a dietitian can help. So I like to recommend with my clients taking very basic steps because they're often easier than jumping full-fledged into a very restrictive or very different pattern of eating. So first I recommend shifting into a healthier diet. Let's transition more towards whole foods and phase out more of those highly processed and packaged foods. This is not an overnight process. This could take a while, especially if these highly processed and packaged foods are favorites or the only foods that the child will eat. So, and also the dietitian is only one part of feeding treatment. Having a physical therapist, speech therapist, occupational therapy, behavioral therapist, feeding therapist, as well as a doctor, we all come together to help piece together this puzzle and have different pieces of advice in getting you through the process of changing the diet. The whole family needs to be on board with this effort because it's really beneficial for the whole family. And we need to remember we're not just doing this for the child, so we shouldn't be singling them out, blaming them, teasing them, because that's not going to help the situation as well. So this could mean cooking more from scratch. So more time management, how are you going to do this? Consuming much less highly processed and packaged foods. A number of those in the autism community believe that this population has more difficulty eliminating potentially toxic chemicals in these highly processed foods, and that some of them are going to be more sensitive to these things than others. So this is going to include artificial colors. We found linkages between artificial colors and increased hyperactivity, irritability, trouble sleeping. We've also seen artificial flavors, particularly MSG. Again, this is a substance that some people can be more sensitive to than others. Those that are sensitive, they could experience headache, chest pain, breathing difficulty, nausea, weakness, just being tired. So these things are often found in packaged foods, soups. We're going to see them in Asian foods because they do provide that flavor. And then we're going to see this in fast foods as well. Artificial sweeteners, they face some controversy as far as what's the long-term effect, especially on children. And so we have seen problems that result from high concentration of artificial sweeteners. Interestingly, in 1994, there was a study that found that parents who believed their children were getting more sugar, they were actually getting artificial sweetener, and they noticed that their children were becoming more demanding. So I thought that was interesting. Preservatives such as BHT, BHA. They've been shown to contribute to behavioral problems as well. So we're going to see those in potato chips, gum, cereals, dehydrated potatoes is where we're going to see that. And then additionally, excessive sugar. So a lot of us believe that excessive sugar or sugar period in the diet is going to increase hyperactivity, although the medical community continues to debate this. So whatever side of the fence you sit on, we can all agree excess sugar is a good move to get out of the diet. And then trans fats, we're also going to see that in these packaged foods as well. As far as linkages to behavioral issues, it's not so much that, more it's a health issue. Trans fats are not going to be healthy for the heart. So eliminating these packaged foods, eliminating processed foods, you're going to have some health improvement and risk improvement whenever you do that. Again, this is not an overnight process. I suggest starting with the easiest foods to eliminate, phase them out of the diet, gradually phase in some of those whole food choices, make them more available. And the reason I recommend this gradual process is, well, these children, they tend to notice even the slightest change in the diet. Utilization, like I said, of other disciplines such as occupational therapy, feeding therapy, we all play a role and we all have different types of advice to help you through this process. But expect that this is going to take the length of time. This is probably going to get harder before it gets easier. Developing a structured eating pattern is also helpful because this helps the child to tune into feelings of hunger, feelings of fullness. If a child is just allowed to graze throughout the day, they're not going to experience that true hunger. They're not going to be able to come upon a new food with more open-mindedness and acceptance. So water between meals only is recommended. No juices, sodas, or teas, just to help with that hunger feeling. And then pairing a new food with a favorite food tends to be more acceptable. Again, this is a process that takes time. Typically, it's going to take about 16 to 18 exposures to a food before a child will accept it. So a child with autism, this might take just as long or longer. So be very patient. And something else that helps is pressure. I know we want our child to expand their diet. We want them to get these healthy foods. It's very stressful. But once we're able to back off a little bit and just have it there, not react negatively or positively, that helps them be a little bit more open-minded about having it as well. Predictable meal times are also helpful, same time every day. And also reducing those problematic distractions. Sometimes light is a distraction, sometimes a certain noise is a distraction, or a certain seating arrangement. So make this as accommodating as possible for the child to have a pleasant meal. Setting concrete limits. So consistency is key in order to build and maintain the structured eating pattern. Set a beginning time and an end time for meals. And also make sure that anyone involved in the feeding, any other caregiver, is aware of these limits that you're setting and that they stick to them as well, and that they're being consistent. Short order cooking, so that's where the child doesn't really accept what you've put in front of them, so you say, okay, I'm going to make you mac and cheese, or okay, we're getting McDonald's. It's, you just want them to eat, and I understand that. You're just trying to get nutrition in there. But what that's communicating to them is their behavior, their refusal of that meal is going to be rewarded with something that they like. The same can be said about candy. It's often a very highly desired food, and for a while it can get the child through their meal, but in the long run it's going to teach them, I have to get through this unpleasant experience so that I can experience this pleasant food. So dinner is always going to be not as good. Assessing basic nutrients in the diet. So this is the new USDA My Plate that replaced face the food pyramid to show balance, kind of a goal for every meal. So looking at that, asking yourself, is my child eating from every piece of this pie? Which food is the most prominently eating? Which food is lacking in the diet? And each serves a very important function. So protein, that's going to contribute to feelings of fullness. So if a child is consuming carbohydrates, mostly they're probably going to be pretty hungry throughout the day, whereas that protein is going to give them that sense of fullness. It also affects our growth, our muscle mass, our hair growth as well, concentration. So we're going to see complete proteins in the animal foods as well as tofu. It contributes a complete protein. We're going to have incomplete proteins, which just lack a couple amino acids, but they're still going to give us proteins such as beans and nuts and seeds, and when combined, they can still provide a good amount of protein for our child. So there are other sources of protein if the child isn't really accepting meats at this time. Carbohydrates, they're converted into glucose, so that's used by our brain. We're going to find this in sweeteners, we're going to find it in grain products, fruits, we're going to find it in dairy, some starchy vegetables as well. Slowly digestible carbohydrates we're going to see in whole grains, we're going to see in vegetables, so those can also help sustain the child to the next feeding time. And then fats, those are also important. They're going to affect our brain, our nervous system as well. The type of fat is important, as I had mentioned earlier, for disease risk reduction. So if it's a saturated fat, which we're going to find in butters and some of the processed foods, we want to try and do those a little bit less, and more of those healthy fats we're going to get in nuts and seeds and avocado and oil. Omega-3 fatty acids are another source of fat. We're going to see those from nuts and seeds. We're going to see those with salmon, tuna, some seafood as well. Water, absolutely essential for everything. It's going to affect bowel function. It's going to affect a child's energy. Whenever they are deficient in water, not getting enough, they can experience weakness and headache, unable to concentrate. And kiddos aren't always the best at communicating their sense of thirst to you, so having that water available at consistent intervals is going to be helpful in keeping them hydrated. Keeping a food diary is very valuable for many reasons. It helps you to identify those trends and helps the dietitian to see as well, okay, what are we doing well, what are we lacking? It's a wealth of information though for you. I've had one parent tell me, well, I notice we eat a lot of pizza rolls, or I notice we don't eat any dairy as much as I thought, so it does help. Supplementing vitamins and minerals. So individuals at risk for vitamin and mineral deficiencies are going to be those with a limited variety in their diet, as well as GI problems because the absorption is impaired. So multivitamins can help bridge those nutrient gaps whenever we are lacking. Zinc deficiency is common among children on the spectrum. We're going to see zinc in animal proteins as well as grains, nuts, and seeds. This can cause a decrease in appetite and also affect our taste buds. And we may also see deficiencies in calcium, iron, which is also rich in animal proteins. We're going to see deficiencies in fiber because fruits and vegetables. And then fat-soluble vitamins D and E. Those are going to be in our milk products as well as our leafy greens, nuts, and seeds. And then certain B vitamins. It's important not to treat a multivitamin as a substitute for healthy eating. So just because the child's on the multivitamin doesn't mean they can still continue the diet that they're on. It's really a helpful resource to get you to where you need to be and give them the proper nutrition until they're able to get more acceptable foods in their diets. also, the multivitamin is going to provide 100% recommended dietary allowance for some nutrients, but not all. So take calcium, for example. It doesn't generally provide 100% of calcium in a multivitamin, so we need to be mindful of that, especially if the child isn't taking much calcium through foods. There was an interesting study that found that boys with autism did have thinner bones compared to other children. Another reason we need to look at calcium as well. Even and whenever casein is removed from the diet, even more important to think about that. Of course, getting a child to take a multivitamin is going to be an adventure in itself. So luckily there are different forms of vitamins these days, chewables, liquids, and powders are going to be of benefit because you can sneak them in small amounts, especially if the child recognizes any change in flavor. You can just slowly increase the amount over time. And then there are some pharmacies that can custom make vitamins, especially depending on what the child is needing, which is another great resource. So if they're able to custom make the vitamin to what the child needs, they can also possibly custom make the flavor as well. And then if you're wanting your child to swallow pills, there are different devices that can help with learning how to swallow a pill. Speech therapy can be a great resource for a pill swallow program because it is quite a process. Fish oil supplements are also beneficial because they affect cognitive function. They're anti-inflammatory, they're heart healthy. Depending on the age of your child, that's going to also affect the dosage that's recommended. But we don't typically see a lot of children as a whole eating fish, as much as recommended in the diet. So omega-3 fatty acids can be a beneficial vitamin and supplement as well. Gastrointestinal issues. One study revealed that 70% of children with autism have some sort of a gastrointestinal issue. 42% of children with other developmental disorders had GI problems. So there are several theories as to why children with autism may be more prone to GI issues, but it's still not resolved. We still don't know for sure why this is happening. And it's also unfortunate that we can easily overlook a GI disturbance as just a typical behavior that we'll see on the spectrum. So if there is something you're suspecting is GI, really advocate for your child and have the physician, if they haven't already, evaluated them for underlying GI issues. Because a child's way of communicating this, especially when they're nonverbal, can be very confusing as well. Children will typically have abdominal pain, bloating, gas, nausea, vomiting, diarrhea, constipation. We can also see acid reflux occurring in this population. Constipation, of course, is going to lead to a decreased appetite, decreased intake of food, whereas diarrhea can lead to nutrient malabsorption. Other red flags to consider: if your child has had GI difficulties as an infant, if they had to be put on a special formula, that would also be something to remember and let your physician know as well, that maybe this hasn't resolved later in life. Food allergies are also common in this population compared to others. We aren't exactly sure of the cause. It's theorized that this population is predisposed to dietary protein allergies to gluten, casein, and soy, which can lead to inflammation. It can also lead to behavioral symptoms as well. Major allergens are going to be milk, egg, wheat, soy, nut, tree nut, fish, and shellfish. And understand that food allergies can affect more than the GI system. We're going to see, ear pain or headaches or trouble breathing. This is a potentially fatal issue if it's not addressed. And when it comes to nutrition therapy, especially when it comes to gastrointestinal issues. It's a very individualized approach, so there's not a consistent one-size-fits-all recommendation that we have. It's a case-by-case basis. But what we can say is that providing water as the main beverage is going to be helpful. Phasing out some other drinks and replacing it with water. With my clients, we just look for ways of how water is more acceptable. So some people prefer their water to be ice cold, or they prefer it to be in a bottle or a certain cup, or they prefer some flavoring in there. So any way that you can sneak that in gradually is going to be beneficial. Physical activity, that's also going to help with bowel function, just getting that child moving in an activity that they enjoy. And then consistent intake of fiber, so we're going to see that with whole grains and fruits and vegetables. That's also going to help regulate bowel function. Using a fiber supplement could be an option, but we need to discuss with a physician first, especially if there's a GI condition present. If there's some sort of a blockage, or if the child has poor muscle tone and they're not able to push their bowel movement, then adding fiber might not be such a great idea, or we might have to start it at a slower pace. Ensure that there's plenty of water when we're adding more fiber into the diet, because if we're not meeting that increased fiber with increased water, then we're also going to experience constipation as well. And then there are supplements that are beneficial. There are fiber supplements beneficial for constipation, and then there are different kinds of fiber supplements that are beneficial for diarrhea if the child is experiencing diarrhea more than constipation. If a child has acid reflux, the precautions we can take for that are not lying down after a meal for at least 1 to 2 hours, sitting upright, and then offending foods are generally going to be spicy foods, greasy foods. We're going to see mint, peppermint, carbonation, caffeine, and acidic foods like tomatoes, garlic, onion. Having smaller meals versus larger meals is also going to help avoid skipping meals, because that can aggravate our GI system as well. And having looser fitting clothing whenever we have something restricting our stomach, if the clothes are too tight, that can also lead to reflux as well. Muscle tone. So again, if a child is unable to push, speak with your provider, see if a bowel aid is appropriate, or if making some simple dietary changes might help, or if one of the therapists has helpful positions that can help this child be able to push a little bit better. Medication side effects, as I mentioned earlier, we're going to see commonly antidepressants, antipsychotics, stimulants, or others. They can increase or decrease in appetite. They can lead to weight gain or weight loss, dry mouth, or altered taste buds as well. And then if a certain food has been identified that's been problematic, then hopefully with removing it, we can start to see improvement. With allergies, some but not all individuals can actually grow out of milk, egg, and wheat and soy allergies if it's earlier in childhood, but fish, shellfish, and tree nut and peanut allergies are lifelong. It's also important at this phase, document. I can't stress that enough. Even if the child is experiencing an issue that you don't think is GI related, document that and what they ate and see if there is a connection that you can make over time. Of course, as a dietitian, we don't want you to go through this journey alone, especially considering so many aspects that having a GI problem can affect. Interestingly, researchers have found that the diet can affect the microbiome. So those are the microorganisms that are inside of our GI tract. It's also in our nasal passages, our eyes. Our microbiome can in turn affect what we're craving. And so it's also worthy to note that this research is ongoing. There have been some developments we've seen, but but there's also things that we just suspect when it comes to microbiome. It's believed, though, that it can affect compulsivity, impulsivity types of behaviors when it comes to food. It can affect anxiety and mood as well. Memory also. And as mentioned previously, adequate nutrition affects the immune function because we have immune cells in our GI tract as well. Studies have not yet determined what's ideal type of diet for the microbiome, but generally we can say more fruits and vegetables. They are going to supply prebiotics that are going to feed the beneficial gut bacteria. Also, we're going to see that probiotics, those are going to be in naturally fermented foods, but we're also going to see these in supplemental form as well. And then whole foods. So again, more foods from scratch are going to be beneficial versus the processed foods. We're going to see benefits from herbs as well. So basil and cilantro and oregano can be beneficial. And interestingly, within 3 days of making dietary changes, we can see changes in our microbiome as well. Whenever we're considering taking a probiotic supplement, that can provide anywhere from 1 million to billions of colony-forming units, so CFUs, of beneficial bacterial strains. We can also get this from eating fermented foods. We're just not going to get the same degree of probiotics from that. But we're also going to, take yogurt, for example. You're going to get a probiotic. You're also going to get calcium, vitamin D, phosphorus, other beneficial nutrients. So getting it from the food source is also very helpful. It's important to discuss probiotic intake if you're interested with your provider, as some populations, those that are immune compromised, are not. It's not exactly safe. And it's also important to discuss the strain of bacteria that's helpful. Some are helpful for IBS or irritable bowel disease, while others are helpful for smaller children. Others are helpful for antibiotic-associated diarrhea. So there's a lot of different options. Once the probiotic is selected, it's very important to take it consistently. We're not going to reap the benefits if it's just taken sporadically. There are those in the community that believe that the gut can leak some substances into the bloodstream. So this can also affect behavior. It can affect physical health. Particularly GI and healing the gut can close those gaps that cause the leakages, can allow these substances to pass through. So the bottom line is, when it comes to GI health, healing the child's gut, improving function, can reduce distraction. It can potentially improve behavior and help the child to be more comfortable to pursue their school and their therapies and their meal times. Better overall health and quality of life. Common nutrition therapies to treat autism. So there are a lot out there, and there's a lot of research, and I wish I could dive into that a little bit more, into a little bit more detail, but I will give you some basics. As dietitians, we're going to encourage nutrition therapies that are founded on evidence-based research, and that can be difficult to obtain. We are aware that autism research is an emerging field, and we're finding new and exciting things every day. We have more to learn and discover. It's difficult to obtain human studies because it's difficult to obtain human research, especially in children that have developmental disabilities. And then having a study designed that keeps everything constant except for the diet. And we know that these kiddos, they're like fingerprints. They are very different from each other. And so that can pose a real challenge. Many interventions that we're seeing are based on personal trials and personal experiences. Overall, whether we pursue a specific diet or not, despite what the conflict of opinions is, we can all agree as professionals is there needs to be structure in the diet. We need to attack at least the basics and introduce these more whole foods into the diet. And I tend to recommend making these basic changes first before we pursue a more restrictive diet for several reasons. And I do recognize basic doesn't mean easy. It's a time-consuming process.